share with you guys another really cool technique that I like to do with the Marc Pro. So I have an athlete here who's about a year post-op ACL meniscus repair. She's an athlete that trains with us, and last week in the gym, towards the end of the week, she was getting up from a bench exercise and kind of tweaked her knee a little bit, and it swelled up a little bit on her, which is very common for athletes that are post-op. They might get some intermittent swelling, even up to a year, like this athlete happens to be. So I evaluated this athlete, and all of her ligament tests came back negative. The knee is solid. She's just got a little bit of joint line of fusion. She's having some difficulty activating that quad. So what I want to show you guys is a nice technique that I like to use in conjunction with the Marc Pro to help kind of aid in some of this lymphatic drainage and getting some of this swelling out of the knee. So I've got my Marc Pro unit here. So what we're going to do is basically just a 1-lead 2-pad treatment, okay? So I'm going to get one pad on her VMO, and then I'm going to stick the other pad up on her kind of common flexor bundle up here in her hip, okay? I like to just do a 2-pad treatment with this because I am going to use some massage lotion around her knee while the Marc Pro is on. So if we just zoom in here, we're going to turn this Marc Pro on. I'm going to use the low frequency setting, and I'm going to just turn it up until I get a nice kind of quad activation, okay? So the least amount of current to get this nice pump happening, and now we're going to start to do some lymphatic drainage work. Okay, so I've got this athlete with her leg up on my shoulder, and you might have seen this in some of my other videos on, managing post-op athletes. This isn't necessarily a post-op athlete per se. I mean, it's been over a year, so I can be a little bit more aggressive because she's not necessarily joint compromised at this point in time. So what I'm going to kind of do is just, again, going back to my lymphatic drainage techniques, I've just kind of juiced this technique a bit more utilizing the Marc Pro, right? So now what I have going for me in this situation is as I'm kind of draining some of these lymphatic vessels around the knee, now she's getting some actual muscle activation that's going to help push that into her bloodstream. So not only are we doing a manual drainage of the knee, we're also using her own muscle activity as if her body was doing it on her own. So we got gravity, muscle activation, and manual drainage all working for us at the same time. Okay, so basically what I want to do is kind of just push some of this swelling out and then do some quad activation work so that we're getting her knee kind of back online for training this week. As a brief review for our lymphatic drainage strokes, we don't need an awful lot of pressure here, okay? I'm basically just doing small, light circles around the outside part of her knee, and I'm also kind of using my thumbs on the back side to kind of push out any, swelling from the posterior aspect of her knee. So one of the most common questions I get when I have athletes and I'm doing this technique with them is, can I do this with any stim unit? And if you have a clinical or commercial grade stim unit, I'm sure that you can figure out a low frequency setting to mimic this type of activity. But if you're talking about just a general TENS unit, I think you'd be kind of hard pressed to get the same comfort and muscle activation that you're going to get from a Marc Pro. Okay, so this is one of the reasons I really like the Marc Pro. This is not something that they advertise this unit as being able to do, but I'm a little less concerned about what it's advertised as doing and what it's actually capable of doing. So this is something that I found anecdotally works tremendously well as a combination of using the kind of the active recovery modality in conjunction with manual therapy treatment. All right, guys, so the next little treatment trick I got for you today is actually involving the grasp of the instruments, okay? So one of the things I really like to do when I have a case of like acute swelling or subacute swelling is to actually use this like a squeegee and actually do a little bit of like a milk massage with it. So I actually took this instrument, 2 of them, and I put them in the freezer while I was doing that first half of the treatment. And the advantage to that is now this is kind of nice and cold, so it's more comfortable for her as I kind of push some of this swelling from around her kneecap, and I've used this instrument to kind of squeegee it on out, okay? So if you've got somebody with lots of swelling, don't push tremendously hard because it can be very uncomfortable. I would say she's kind of in that mild to moderate range in terms of the amount of swelling she's got going on. So I'm using a little bit more pressure than maybe I would if this was like a post-op, like immediate post-op ACL, kind of really grossly swollen type of situation. Again, this is not a ton of swelling by traditional standards, so I'm gonna be a little bit more aggressive with it. Again, still using the Marc Pro to get some muscle activation as I'm doing this, still using gravity to my advantage. I've got this bolster under her knee to kind of keep her knee from kind of slamming in extension, which got us in this situation to begin with. So I'm using my little concave, my double concave instrument here. It fits really nice around the knee and it allows me kind of really to push this swelling out. And I'm continuing this stroke all the way kind of up the quad. Okay, if you have somebody with a bit bigger knees, that's where maybe this instrument, a concave instrument like this, would come into play. And again, kind of the same idea, working that swelling and kind of squeegeeing it up the leg. You know, you can work it towards the groin, really start working this out. How's that feel, okay? No? So we're gonna reshoot that. I'm gonna say, how's that feel, okay? And you'll be like, yeah, it's okay. Ready? So how's that feel, okay?
Feels great.
Feels good? Yeah. She's full of crap. It doesn't feel good. It actually kind of hurts a little bit. When you come on in here, you can actually already see that this is starting to look much like a knee again. We've already got some outline of a patella happening here, which was not happening before. Her kneecap was kind of floating in some swelling when she first came in today. Again, you could do a similar technique if you wanted to with, you know, a post-op athlete, but again, I would just caution you on the amount of pressure that you're using so that you're not kind of overloading that groin. So some people that have a lot of swelling, if you do a lot of lymphatic drainage with them or like compression treatment, they'll have a lot of groin pain where those lymph nodes are getting super clogged up, okay? I'd like to love you every day. I'd like to love you, love you. I'd like to love you, if I may, if I may. I'd like to love you, love you. I'd like to love you, love you. I'd like to love you night and day, if I may, may. I'd like to. I'd like to love you every day. I'd like to love you. Alright guys, so the last thing we're going to do for this athlete today is I really like to kind of send my athletes out the door with some feel-good stuff and something that's going to kind of improve or augment this treatment over time, and that's where the ROCKTAPE comes in, okay? So I got this Big Daddy strip, so I'm going to cut this so that we can do some lymphatic drainage with it, so stay tuned, check it out. Dose. All right, cool. Alright guys, so before you apply your ROCKTAPE, you're really going to want to make sure that the skin is very clean and dry. Use regular rubbing alcohol for that, especially since I use cocoa butter on her. Otherwise this tape won't stick so well. So we're going to clean her off real good. And we're going to start our first lymphatic drainage strip kind of up here in her groin. So I like to keep my anchors towards the lymph nodes when possible so that we're kind of pulling that fluid towards that area. Okay, so I'm going to break off these tails. We're going to lay these down one at a time with very, very little tension on them. 2. A quick little treatment of how you might want to incorporate a Marc Pro device, some instrument work with the cold instruments, and a little bit of a ROCKTAPE finisher for a bit of swelling in the knee. So I hope you guys enjoyed this episode of Session Sit-In. If you like what you see, please subscribe. Leave any comments or questions in the description below. You can follow me on Instagram at MikeStella_ATC. You can follow AMP on Instagram at AMP_athlete. Visit us online at ampathletes.com/recovery lab. Thank you guys so much for your time, and we will see you guys next time.